Hearing the phrase "you have cancer" can be shocking and leave patients feeling anxious or afraid. That's why specialists like Dr. Maricela Rangel-Garcia say screening is important, and when found early, colorectal cancer can be highly treatable. Dr. Maricela Rangel-Garcia is a gastroenterologist specializing in treatments of the digestive system and says it's important for patients to listen to their bodies and advocate if they feel something is not right.
I think it's really important for people to be aware of what is their normal and what is changing for me and how am I feeling, and being able to advocate for themselves in that sense of this is not right, this is not my normal, and I need something more.
Colon cancer is the second leading cause of cancer-related deaths worldwide, and Dr. Rangel-Garcia says symptoms can often be mistaken for other digestive diseases.
Things like hemorrhoids, which can cause rectal bleeding, inflammatory bowel disease like ulcerative colitis or Crohn's, which can also cause abdominal pain, anemia. It can cause diarrhea, bloody stools. Some symptoms of colon cancer, they present the same way.
She says most of the cancers they diagnose come from polyps found in the patient's colon.
There are other types of cancers that can arise in the colon, but those are rare.
While some types of colon cancer can have no symptoms and go undetected for years, there are some symptoms that Dr. Rangel-Garcia says you might be able to see.
In terms of symptoms, people notice blood in their stools. That's one really common concern that patients present with. And it starts off as, well, I had it like once or twice and then it went away, but now it's every day. And so here they are kind of, seeking answers.
However, other people can have severe abdominal pain, cramping, and unexplained weight loss.
Others complain of change in what their stool looks like. So instead of having a normal bowel movement every day, they're not straining, they feel a little bit more constipated. They feel after they've had a bowel movement, they might have to go again.
Undergoing screening. That can be done several ways. One way is through stool-based tests.
So the stool-based tests are the FIT and FOBT, and then the stool DNA markers. Like Cologuard, which many people have seen on television.
Visualization screenings or colonoscopies are another way to check for colon cancer.
When we do colonoscopies, we can actually visualize with the scope the inside of a person's colon. We look for polyps, and we most of the time take polyps out unless we think we can't do it at that time for one reason or another.
Understanding your family history, as well as making healthy eating habits and exercise, can all help minimize your risk of a colon cancer diagnosis.
Talking to your family about family history, about colonoscopies and colon cancer screening is really important because a lot of the guidelines pertain to people who are average risk.
For more information about cancer services available through Community, visit communitymedical.org/cancer. Make sure you're following along with us both on air and online. Find us on Facebook and Instagram. Just search Community Health System. As for the only locally owned not-for-profit network here in the Valley, Community Health System's 4 hospitals are connected to a wide variety of outpatient services, making sure you and your family are cared for through all stages of life. To find out more how to give back or to watch any of these stories again, head over to our website, MedWatchToday.com. I'm Juanita Adama, and that's all for this week's episode of MedWatch Today. Please join us next week for more inspiring stories from inside Community.